What is the autism diagnosis process? The autism diagnosis process is a structured assessment used to understand whether a person meets autism diagnostic criteria. Looks at communication and behaviour, includes sensory and developmental history, uses interviews and observation, may involve school, work or medical input. Screening alone cannot confirm autism. Autism screening versus autism diagnosis. Autism screening suggests whether further assessment may be needed, while diagnosis provides a formal clinical answer. Screening is an early check. Diagnosis is a full assessment. Screening cannot confirm autism. Diagnosis may include a report. Both play different roles. Why someone might seek an autism assessment. People seek an autism assessment to better understand developmental, social, sensory, or everyday life differences. Parents may notice early signs, adults may recognise lifelong traits, can explain long-term challenges, helps identify support needs, can guide therapy or adjustments. Who can diagnose autism in Australia? A child or adult may be assessed by one experienced clinician or through a broader team-based process depending on the service. Paediatricians, psychologists, psychiatrists, multidisciplinary teams, allied health may also contribute. What matters most is that the assessment is thorough, evidence-based and completed by professionals with experience in autism assessment and diagnosis. Autism diagnosis in children. The autism diagnosis in children pathway often begins when parents, carers or professionals notice differences in communication, play, routines or sensory responses. May start in toddler, preschool or school years. Often begins with a GP or paediatrician. Can involve early autism assessment, includes history, observation and interviews, ends with feedback and a written report helps identify strengths, needs and next steps. Autism. Diagnosis in adults. The autism diagnosis in adults pathway helps many people understand lifelong patterns in communication, sensory experience, routines and daily life. Often begins with self-recognition. May involve a psychologist or psychiatrist, explores childhood and current experiences, includes interviews and structured tools, can bring clarity, relief and support. Ends with feedback and a written report. Note down key childhood and current experiences before the assessment. What to look for. During an autism assessment, professionals look at patterns across communication, behaviour, sensory experience and daily functioning, rather than relying on one quick checklist. Social communication and interaction, non-verbal communication cues, routines and preference for sameness, repetitive behaviours or focused interests, sensory sensitivities or sensory seeking, emotional regulation and daily functioning, developmental history and real-life impact. How long does the autism diagnosis process take? The autism diagnosis process can vary in length depending on the provider, pathway and number of assessment steps involved. Public and private wait times differ. Location can affect access. Some assessments need multiple sessions. Time may include intake, assessment and report writing. Ask about wait times, number of appointments and report turnaround. Cost of an autism assessment in Australia. The cost of an autism assessment in Australia can vary depending on the provider, pathway and level of assessment involved. Public and private costs can differ. Fees may depend on age and service model. Some people may be eligible for Medicare support. A GP referral may be needed in some cases. Public pathways may cost less but take longer. Private pathways may be faster but more expensive. Always ask what is included in the total fee. How to prepare for an autism assessment. Preparing ahead of time can help make the autism assessment process clearer and more useful. Write down key examples and concerns. Note: communication, routines and sensory differences. Bring school reports or past assessments if relevant. Adults can reflect on childhood and current experiences. Prepare a few questions before the appointment. What happens after an autism diagnosis? After an autism diagnosis, the focus usually shifts to understanding support needs and planning the next steps. You may receive feedback and a written report. The report may explain strengths and support needs. Families may explore therapy, school, or home supports. Adults may seek workplace adjustments or mental health support. The next step depends on the person's goals and needs. Challenges in the autism diagnosis process. The autism diagnosis process can be valuable, but access is not always simple or quick. Long wait times, especially in public systems, private assessment can be costly. Fewer specialists in regional areas. confusion about screening versus diagnosis, uncertainty about referrals, providers, and next steps. Next step in the autism diagnosis process. The goal of diagnosis is not just clarity, but a better path toward the right support. Helps identify strengths and support needs, can guide therapy and practical supports, may support school or workplace adjustments. Affective Care offers emotionally centred support, focuses on personalised care and daily living goals.